that lifestyle factors like smoking and drinking can contribute to diabetes? And do you know which organs are affected by uncontrolled diabetes? To get answers for these and more diabetes related questions, join us in today's live session of Apollo 24/7's Health Hour, where a senior endocrinologist, Dr. Ravi Sankar from Apollo Hospitals, is going to answer all your questions. So join us and know how to manage diabetes in the long run. See you there, 11 a.m. sharp.
It's always been there, standing between you and your health. A wall. Between a pain that won't disappear and a doctor who magically appears. Between a long wait on a hospital bench and staying right where you are, at home. Between finding yourself out of medicines and finding them at your doorstep, whatever the time. Between years of health records all over the place and all your records in one organized access from anywhere place. Between your current regimen and the recommended routine. The wall. We don't need it anymore. Say hello to Apollo 24/7. This is India's largest end-to-end omni-channel healthcare ecosystem, designed to touch more lives than ever before and delivering its promise in 3 important ways. 1. Listen. Talk to us anytime from anywhere. We've got 7,000 doctors and 30,000 healthcare professionals listening. 2. Advise. We'll give you expert advice you can rely on, because it comes from India's #1 healthcare provider. 3. Assist. We bring you India's largest health network of pharmacies, clinics, hospitals and health insurance experts. 20 million people already trust us for their care, and a further 50,000 people are discovering this every day. Apollo 24/7. Expertise is for everyone.
Namaskar and welcome to Apollo 24/7's Health Hour. This is a show which brings you experts to your doorstep every Sunday morning. We bring you an expert for your questions that remain unanswered. We understand that there are many questions where you don't want to go to a doctor and ask. You might feel that this is not a question to take. So here we bring you an opportunity where you can talk about organ damage due to diabetes and understanding and managing diabetes in the long run. Joining us in this live session very shortly is Senior Consultant Endocrinologist from Apollo Hospitals Jubilee Hills, Dr. Ravi Sankar. This show will also give you answers for your questions, so make sure that you're typing your questions in the chat box. We'll take these questions up with Dr. Garu and we shall give you we'll try and give you some answers. And also, the show will have some questions. I'm going to ask you health quiz questions, 3 questions where you can win prizes from Apollo 24/7 as well. Stay with us till the end of the show where we're going to give away gift coupons and discount coupons as well. All right, let's start the show by asking one question. Are you vaccinated? I'm vaccinated, and I hope you're all getting vaccinations done. And we understand that finding vaccinations was a little trouble earlier. We were always on the lookout to find a slot. But now, no more waiting, no more hassles. You can book your vaccination slots on Apollo 24/7. Do download Apollo 24/7 app first and then click on the book vaccination slot. You can choose from 200 plus vaccination centers of Apollo hospitals. Select the vaccine type that you want to get done and the dose, first or second dose, and that's it. It's quick, safe, and easy. If you want more details on this, or if you want to book your slot right away, there's a QR code on the screen. Go ahead, scan the QR code and book your slot right away. We for India, Apollo is trying to vaccinate the entire Indian population, so join the vaccine wagon. All right, let's start by talking about a wonderful initiative which is started by the Apollo Foundation, which is called Saving the Child's Health Initiative. Apollo's top pediatricians, renowned pediatricians, are coming forward to give free pediatric consults for children, especially underprivileged children, at no cost. This is an initiative which is in association with Apollo 24/7, an online virtual consult where there are free pediatric consults for every child who is in need. Go ahead, save our children's health. If you know anybody who requires this kind of information, please pass on. There is a QR code on the screen. Go ahead and scan that for getting more information. All right, let's get into today's topic. Our topic today is organ damage due to diabetes. We're going to talk all about diabetes. Let me invite our endocrinologist, Dr. Ravi Sankar Erukulapati, who's a senior consultant endocrinologist at Apollo Hospitals Jubilee Hills, Hyderabad, who has more than 17 years of experience in treatment of diabetes, obesity, and thyroid disorders. He's trained and worked in UK for a decade, who's a member of Royal College of Physicians, UK. He's a gold medalist during MBBS at Guntur Medical College. He has papers, publications, and presentations published in reputed medical journals, and he's very passionate about teaching, clinical research, and patient education. Namaste, Dr. Ravi Sankar Garu. Welcome to the show once again.
Namaste, Ms. Jhansi. Good morning to everyone.
Wonderful. It's always a pleasure having you back on the show because this is one topic where everybody wants to meet you.
Pleasure is mine.
Thank you. We understand that India is becoming the diabetes capital of the world, and we are catching up really fast on diabetes. Why are we like this, and what are the reasons which have caused this surge? I'll ask that question a little while later. But let me understand, diabetes is not a disease per se, right, doctor? So it might cause complications, other complications. So what are the complications which might lead to other organs, issues, and other diseases?
Well, Ms. Jhansi, you really asked me questions for the next 1 hour already. We already harbor about 8 crore diabetic population in India. In another few years, at least by 2045, the estimates say that this number is going to double. This is not something which we can be really proud of. In fact, when I was studying my medical school, I've been told by a professor that unfortunately, India will be taken away by the dreaded AIDS disease. Fortunately, it hasn't happened because of the various initiatives taken by the government. But unfortunately, a non-communicable disease in the form of diabetes and obesity pandemic or epidemic, as you like to call it, has engulfed India and most other parts of the world as well. Certainly, this is not something that we can be proud of, and we ought to be very careful about how we deal with it, lest we will pay the consequences of this in the very near future. We are already paying a lot of, I would say, consequences and healthcare burden because of this. I would say that this pandemic is going to continue, unfortunately, even if the current pandemic of COVID were to abate. So we ought to be very cautious about this.
So if you are not controlling, if somebody who's not managing their diabetes well, what are the complications that might arise?
Well, many people think that controlling diabetes is just controlling blood sugar. Unfortunately, it's not as simple and straightforward as that. You ought to control blood pressure, sugar, cholesterol, And you ought to screen these patients on a regular basis for the various complications of diabetes. If you were to not do that, then these people would easily develop many of the complications pertaining to diabetes. And in general, we classify these as macro and microvascular complications. When we speak about macro, we're speaking about heart attacks, brain strokes. That means the complications that affect the big blood vessels in the body. When we speak about microvascular complications, we are speaking about retinopathy, that means damage to the retina in the eye. We're speaking about nephropathy, that means damage to the kidneys. We're speaking about neuropathy, that means damage to the nerves. For instance, people complain that they do have burning sensation in their feet. This is nothing but
Right.
neuropathy. And I haven't mentioned about other complications such as peripheral vascular disease, erectile dysfunction in men, so on and so forth. And there are other complications as well, such as skin complications. Just before coming to this show, I'm dealing virtually about a patient who has ended up in emergency department with a dreaded complication called diabetic ketoacidosis. So these are all the complications that people can develop if they were to have diabetes, and one ought to be very cautious in terms of taking care of their blood pressure, sugar, cholesterol, going through regular screening tests for these, and making sure that they don't develop these complications for their own good and, of course, for the sake of their families and the society at large.
Very, very well said, doctor. Because it's not just for one person, it's also for the society, the family, the people who are dependent on them. All right. So, as I was introducing, I was also talking about the lifestyle changes or lifestyle causes that might lead us to diabetes or diabetes related damage. What are these lifestyle issues that one has to keep in check? Smoking, alcohol, etc., etc.
See, when we speak about lifestyle, it's about how we lead our life, isn't it? As soon as you wake up in the morning at whatever time you wake up, be it 5 o'clock, 6 o'clock, 7 o'clock, 8 o'clock, and till you go to your bed. So, what sort of rhythm are you maintaining? What sort of discipline are you following? What you are eating, the quantity of food, the quality of food, the exercise that you do or that you don't do, whether you're taking stairs, whether you're taking the escalator, whether you're walking upstairs. Okay, these are the simple things, but these all matter, and these are part and parcel of your lifestyle. And not to forget the other most important aspect: what time you sleep, what duration do you sleep, how many times do you wake up in the middle of your sleep. These are all things that add up and actually can be quite detrimental if you don't do it rightly. And cumulative damage over a certain span of time can really add up to the burden of your disease and can lead to various complications, be it obesity, diabetes, high blood pressure, and these are all called non communicable diseases. Many people just equate lifestyle to just smoking and alcohol and unfortunately drugs these days. But it's not just these. These are definitely vices, or as they're considered to be. Smoking is, of course, one of the
Okay.
most dreaded thing that we would advise even the worst of our enemies to actually quit. The best cigarette is the unsmoked one, as we say, right? And coming to
Right.
alcohol, yes, it is supposed to be a fun sport, but what starts as a fun sport in your teenage can lead to serious complications if you don't actually handle it well and if you haven't got control of what you drink. So that is
Yes,
in
and
essence about lifestyle.
right, right advice coming, very, very powerful advice coming from you there. So I'm understanding that there are warning signs. Once you understand that there is something going overboard, you need to catch hold of it there and get it back. So what are the warning signs? I'm not talking about a person who doesn't have diabetes. Let's talk about from a person who has diabetes, and what are the warning signs that they have to watch out
So first, we need to understand as to why a person develops diabetes. A person can develop diabetes if he or she has genetic predisposition to developing diabetes. For instance, if they got a sibling, brother, sister, or if they got a parent who got diabetes, then you are at high risk of developing diabetes. So this is because of genetic predisposition. This is not something that we can change at this current juncture. We might be able to change this in the future because of medical technology, science, making leaps of progress in the future. But at this current juncture, there is not much that we can do about this. But there is a lot that we can do in terms of our lifestyle, environmental factors, as we discussed earlier. That means if you were to have a genetic predisposition to developing diabetes, and if you were to really do the extra bit in terms of your diet control, in terms of your exercise, you can prevent developing diabetes and obesity. I still remember I used to have a professor in UK. It's called Mr. Rama. Okay, he's a second generation guy who settled there. So this chap, he has got a family loaded with diabetes. Both parents are diabetic. He's got siblings who are diabetic. But this chap used to be so cautious. He himself is a is an endocrinology professor. So he was very cautious about what he eats and how he exercises. So by doing all this, he could actually delay developing diabetes. I don't know if he developed now, but he didn't certainly develop when I used to work there. So what I'm trying to say is you can have some control over what you eat and what you exercise and how you lead your lifestyle. You may not have control over the genetic factors, which are way beyond anyone's control. So what I'm trying to say is whatever is within your control, at least tackle them in the right way so as to not develop diabetes or at least defer the stage of development of diabetes. And coming to the other question that you asked, what are the various symptoms and signs that one need to look for? There are many symptoms and signs that one has to actually keep in their mind when we're speaking about diabetes. For instance, one can have what we call as osmotic symptoms. In simple words, excessive thirst. If somebody is drinking gallons of water, if somebody is going to the loo quite often, if somebody is waking up 2, 3, 4 times at night to go to the loo, if somebody is losing weight in an unexplained manner, tired in an unexplained manner, has got change in vision, developing infections time and again, for instance, what we call as thrush, candidiasis, or if somebody's small cuts are not healing easily, then all these might be pointing towards what we call as the early symptoms and signs of diabetes. But having said that, some people may not have any signs and symptoms whatsoever and may actually get picked up during an incidental screen when they go to the hospital for another health issue or for a surgery during their preoperative screen or sometimes even for insurance purposes. So there are various factors that we need to consider in the form of, say, routine annual screening in people who have got high risk for developing diabetes, or in the form of regular screening if a person were to have something called pre-diabetes. So we need to put all these into context when we screen a person for diabetes.
Right. So you were talking about vision loss, doctor, as I was hearing. So what is the vision loss which is due to diabetes, and what is a, normally also people might have certain amount of visual difficulties. So how does one understand that this vision loss is happening due to diabetes?
When people develop diabetes and when there are big fluctuations in their blood sugar levels, what happens is because the lens, which is very important for normal refraction in our eye, can undergo a lot of osmotic changes. What happens is your vision can become a bit blurred. So this is something different from losing vision because of diabetes. What I told you earlier can be reversed. It's a temporary phenomenon because of the osmotic changes in the refraction of the lens in the eye. So that is very much reversible. But what is not reversible is if you were to lose your sight because of retinopathy. Sometimes people develop so many dots and blots on their retina, the screen behind your eye, which is very important for the normal vision. And if at all this retina were to get damaged, you may lose your vision permanently. So in order to prevent this, you need to control your blood pressure, you need to control your sugar, you need to control your cholesterol levels, and of course, undergo what we call as annual retinal screening. That means you need to get your eyes screened every year once. Many people, unfortunately, do not understand the importance of this, and they just think that diabetes care is about just controlling fasting and postprandial blood glucose levels, which is unfortunately still the case in most parts of our country.
Right. So also I understand that a diabetic person is prone to have limb and other skin issues. The feet and diabetic foot is a major cause of concern. How does one
Earlier,
understand?
yeah. Let me draw one question that you asked at the earlier stages of the show as to whether diabetes is a disease. No, diabetes is not a disease, strictly speaking. It is more than a disease. It is something like a syndrome. That means it is something which can affect each and every part of your body. It can affect everything right from your top to your toe. It can affect your brain, it can affect your eyes, it can affect your liver, it can affect your heart, it can affect your kidneys, it can affect your skin. There is no organ in the body that is spared by diabetes which is not well controlled. But having said that, it's not all doom and gloom. If at all you were to control your blood sugar levels on time in a proper manner, if you were to control your blood pressure well, cholesterol well, undergo the routine screening tests in the way things are recommended, you would be able to control all these and not have any of the complications that I earlier mentioned. So, coming to your specific question about how it can affect your skin, as people can develop regular infections, people can develop serious complications such as diabetes related specific complications of the skin. People can develop thrush, as I was previously mentioning. Thrush is a sort of fungal infection of your private parts or your tongue. And these things are usually neglected if at all a person were to be neglecting his or her sugar levels. And these can lead to serious deleterious complications by themselves. So it is very important to make sure that these things are prevented. What is neglected in the form of a simple crack of the heel can sometimes lead to amputation of the limb. So it can be that dangerous if at all the sugar were to be really not controlled, and if at all people were to neglect what is otherwise considered, come on, yeah, it's only a simple crack of the heel. So even simple things, if neglected, if not attended on time, can lead to serious complications, unfortunately.
Right. So understanding the that this can lead to complications, that means we are on a constant pressure of monitoring certain things. As I'm talking to you, I'm looking at the chat box, which is buzzing already. So Sean David was asking the question: what are the regular tests or screenings to be done if one is diabetic?
So we check for what people, almost everybody knows this, fasting and postprandial blood glucose levels. We check for HbA1c, which is also called glycated hemoglobin, which gives us an estimate of the last 2 to 3 months sugar average. We do check for creatinine, which is a standard kidney blood test. We check for urine albumin creatinine ratio to screen if a person is predisposed to developing any kidney problems in the future. We do check for ECG for any relevant changes, and sometimes even do more sophisticated tests pertaining to the heart if at all relevant. The blood pressure is as important as blood glucose in people who have diabetes. We also screen for any retinopathy, that means damage to the eyes, which I was previously mentioning. We do check for any loss of sensation in the feet and any cracks and any disturbance to the pulses in the feet as well. So these are the very basic things that we do check for in people who have diabetes. Not to forget the cholesterol that ought to be checked periodically. And of course, not to forget the most important aspect, the body weight and the waist circumference as well. Because if one were
Yes,
to actually
please continue.
yeah, because if one were to keep on piling kilos, then obviously the blood glucose control would certainly not be in the range that we want it to be, nor the blood pressure. So, if you want to really have optimal outcomes, it all boils down to how you lead your lifestyle. Whether you want to lie on your couch till morning 8 o'clock, 9 o'clock, eat your sumptuous breakfast on a Sunday morning, and the nice, lovely biryani that you want to graze on at lunchtime, and also the snacks in the evening, do no exercise, invite trouble for you, or you want to hit the gym, or you want to do whatever you want. You can go for swimming, you can play shuttle, Olympics. I mean, the spirit is on, isn't it? Because of the medals that we guys are winning. And ladies, of course, not to forget the most important aspect there. So I think it's very important to make sure that we hit the gym or do swimming or go for a run or do nothing but a 45-minute brisk walk. Do whatever you
Right.
want in the form of good physical activity, and this will keep diabetes at bay if at all you're at risk of developing diabetes. And of course, eat the right quantity of food, and even if you are to eat the right quality of food, make sure that the quantity is not way beyond what it should be. So these are very simple and very important factors that you're supposed to follow. And if you follow these, I think even if you were to develop diabetes, you will be able to handle your diabetes. and may even be able to reverse your diabetes. So in the initial 5 years, you can even reverse your diabetes if at all you take all the precautions that I mentioned earlier.
Well, in continuation with your answer there, Aj Moed is asking this question: is diabetic reversal possible?
Well, yes, we're speaking about type 2 diabetes here. When I speak about reversal, we can't reverse type 1 diabetes. Okay. If a person were to have type 1 diabetes, okay, you have to use insulin, full stop. Okay. At least at this juncture. Because there has been, unfortunately, a myth going around that people with type 1 diabetes can come out of insulin. Unfortunately, you can't and you shouldn't. If you try to do anything like that, that would actually be a misadventure and you will end up with diabetic ketoacidosis, which is a very dangerous complication and even death. But if you were to have type 2 diabetes, and if it is within the initial few years, ideally less than 5 years, and if at all you were to follow a strict diet and exercise regime as advocated by your doctor and a dietitian, then you might be able to reverse your diabetes and you might be able to stay away from any medications whatsoever for a considerable period. We call it remission in medical terms. In simple words, you can call it reversal of diabetes. So certainly it is possible, but you ought to be focused on what you're doing, and you can't just lay down on your couch and expect that diabetes would reverse on its own. It unfortunately doesn't happen that way.
Wonderfully
But
said. There's no
but if you were to be really focused in terms of your exercise regime, in terms of your diet, it is certainly possible. There are many patients of mine who could achieve that, and why not you? Why not you? If you fit in all the boxes.
Wonderful, Mohit. So that's the answer for your question. And next question that I want to take is about a lot of them are asking. Padmanabhan B ka question hai. H1ABC. No, I think yeah. Good morning, doctor. 6.3 is HB1AC. Is that right? There's some alphabet juggling happening there. So, what is the range that monitors that puts you into diabetes or pre-diabetes?
See, basically, there are certain criteria which define as to whether one is diabetic or pre-diabetic or not in any of these categories. And remember, this is a continuum. It's not like you develop diabetes all of a sudden 1 minute. No, it doesn't happen that way. Usually, what happens is somebody who is in the normal range over a span of few weeks and months and years would come into the pre-diabetic range and slowly slip into the diabetic range if he or she does not take care of himself or herself. Okay, so it's a continuous process. It's not something which happens just like this. Okay, so if at all you were to keep a vigilant eye on your general health and get yourself screened for these parameters, be it the fasting postprandial blood glucose levels or HbA1c, there are certain targets that we need to aim for. There are certain ranges that have been defined by various organizations which decide as to whether somebody has got what we call as impaired fasting glucose, impaired glucose tolerance, or otherwise called pre-diabetes, or in the diabetic range. Okay, so these numbers would help us understand if a person falls in the diabetic range or in the pre-diabetic range or in what we call as the normal range. So I don't want to go through the numbers and confuse you guys, but it's important to know that there are certain numbers and numericals that would help us make you understand as to whether you fall in a certain range. Going by your specific question, 6.3, if you are not taking any medications, if you're not known to be having diabetes in the past, then this is what we call as pre-diabetic range HbA1c. Okay, so the 6.3 could actually turn into 6.5 or more, which is in the diabetic range. So 6.5 and above is diabetes. So 5.7 and above till 6.4 A1C, according to ADA criteria, would come as pre-diabetes. So there are certain ranges as per ADA, American Diabetes Association. There are certain ranges according to WHO. So 6.3, irrespective of WHO classification or ADA classification, is pre-diabetes.
Done. So understanding that there is a there is a chance of getting into diabetes and one can control, you have to take action, right? So Rangarao Venkata Sayam, can a 45 minutes brisk walk be broken into a morning walk of 25 and an evening walk of 20? Does it have to be one stretch? Is that good enough?
Well, it all depends on what your stamina is, whether you've been exercising in the past, how fit and active you are, whether you have other comorbidities. Now, for instance, if a person were to have, say, arthritis and unable to walk long distances at a single stretch, then it makes better sense for that person to take appropriate orthopedic or physiotherapist advice and split that 45 minutes into two halves. Okay. So it's not written on stone that you have to do all the 45 minutes at one time. Although it is ideal to do it in such a manner, if you can't do because of lack of your time or because of other reasons that I mentioned, you can split that into two halves. Okay. Some
Yeah,
activity is definitely better than none. And splitting it into two halves or three separate portions is definitely better than not doing anything. So what we suggest
exactly.
is, yeah, if for instance, if you're working in an office and if you are doing a sedentary job, then it is of paramount importance that you actually take small breaks in between. Okay, go for a small stroll and come back to your desktop so that you get some physical activity and you also can probably focus better on your work as well. So these are the sort of simple things when we speak about lifestyle, when we speak about exercise and being physically active.
Great. So, Pavan, just hold on. I know you're asking a very important question. I'll take that question up a little while later. And Andalugaru, please share doctor's contact to consult. Yes, Dr. Ravi Sankar is available on Apollo 247 platform. You can consult. We'll leave the link of doctor's consultation here on the chat box itself. Sanjay Chavla 376 पूछते हैं डॉक्टर, son is 12-year-old, 12 साल का बच्चा है, and HbA1c is 5.9, weight is 79 kilos, he's reduced 5 kgs in 2 months. What all can he do to prevent further damage?
See, unfortunately, childhood obesity and childhood type 2 diabetes are on the rise. We need to speak about the various types of diabetes in this context. We do have type 1 diabetes, which is, I would say, roughly about 5% of the total cases of diabetes. It's more common in younger age groups, although it can occur in older individuals as well. Usually, it is seen in the younger age groups. Okay, then you do have type 2 diabetes. Type 2 diabetes composes about roughly 90% of the total cases of diabetes. Usually, it used to be seen in the older and middle age groups. But of late, it has been seen even in the younger age groups because of the rising prevalence of obesity in the young adults and in the childhood age groups. This is of serious concern, and this is mainly because of the lifestyle changes that we have discussed earlier. Lack of exercise, increased screen time, playing with mobile phones, or gadgets, or your laptops, or watching television, and eating a lot of junk food, including processed food and our own conventional desi junk food. So all this adds up, and it has increased the burden of childhood obesity. Not to forget that there have been hardly any sports and physical activity in the younger generation because of various reasons. Of late, it is COVID that has to be blamed. But even before COVID, let's be honest about this. I mean,
Yes.
how many schools have good playgrounds? Okay, school equates to a concrete building these days. At least most of the schools. I'm not trying to say every school is such, but most schools. And parents also have been pushing kids just to study, 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 and study, but not focus on physical activity. No wonder obesity is on the rise in children. No wonder type 2 diabetes, which used to be seen in the older age groups, is seen in the younger age groups of late. And
Okay.
we do come across type 2 diabetes in kids of this age, unfortunately. And this is not a very good thing. But suffice to say that we need to exclude type 1 diabetes in anyone who has got higher blood glucose levels in kids. Only when once type 1 diabetes is excluded, we can call it as type 2 diabetes. Of course, there's a rare type of diabetes called monogenic diabetes or MODY. Modi as well. I'm not discussing about that at this juncture. We're speaking about childhood obesity and type 2 diabetes in children. So I think it's very important to make sure that the kid exercises regularly, the kid eats the right kind of food, takes advice from an endocrinologist or a proper trained dietitian, and sheds those extra pounds in a healthier manner so as to not develop type 2 diabetes.
Okay. So now for Pavan's question, Pavan has been asking the same question. What age can one develop diabetes?
See, diabetes can be seen in a newborn to somebody who is an octogenarian. Okay, so it can be seen across all age groups. But as I previously mentioned, as one ages, the chance of developing type 2 diabetes increases. So age in itself is a risk factor for developing type 2 diabetes. This apart, we need to remember that if at all somebody were to be obese, if at all somebody were to be a smoker, if at all somebody were to be not leading a proper lifestyle, if somebody were to be not sleeping on time or sleeping only for less number of hours or waking several times in the middle of a night, then all these would push the individual towards developing what we call as obesity or diabesity as it is called these days. So
Oh,
diabetes and obesity together have been called as diabesity. And let me actually draw your kind attention to smoking and sleep for some time. Smoking can increase the risk of developing type 2 diabetes on its own merits or dismerits, as you can call it. So, if at all somebody were to be a smoker, even if the person does have good genes, that means genes that do not predispose that individual to developing diabetes, sheer smoking can push this individual to developing type 2 diabetes. And smokers have a higher chance of having poor glucose control as well. This is very, very important.
right.
So this is something that I want to draw everyone's attention to. So if at all you want to quit smoking, now is the time, not tomorrow. You smoke the last cigarette, that's it. Okay, you can take help from your doctor in terms of how you can come out of the physical and psychological dependence. There are various maneuvers by which you can come out of it. There are some medication as well. So think about this and quit your smoking right now. So this is very important. And coming to sleep, I think this is another very important aspect. Let me actually draw your attention once again to this. See, people who don't sleep on time can actually affect their biological clock, and biological clock has been made in such a way that you're supposed to sleep at say 10 o'clock and wake up at half 5 or 6 o'clock in the morning. But unfortunately, if you were to disturb this cycle, then the various hormones that are supposed to be quiet during nighttime, such as your corticosteroids, keep on secreting. So your body is under some form of physical stress, and this would actually make you pile on weight. This would actually increase your risk of developing heart attacks. This would actually increase your risk of developing type 2 diabetes. And all this together would make you look aged as well, if at all you're bothered about your looks. Okay. So there is a good reason to actually sleep on time, sleep for the right amount of hours, not play with your gadgets in the middle of the night. I mean, this is another addiction that we keep hearing. And follow some sleep routine and sleep hygiene if at all you want to keep all these non-communicable diseases such as obesity, diabetes, hypertension, etc.
Right. So, Doctor, next question I would want to share with you is Mr. Vadlamani Kishore's question. For diabetic retinopathy, is the laser and injections, okay, are laser and injections only treatment or any latest technology?
See, this is a sophisticated area. Okay, you need the real help of a properly trained ophthalmologist who deals with retinal problems. We're not speaking about the routine ophthalmologist or the routine family doctor here. You need an eye specialist who is trained in retinal problems, and such specialists can help you in terms of giving laser, or there are injections that you actually mentioned. So, depending on what stage of retinopathy it is, these ophthalmologists can guide you and treat you appropriately. Not to forget the importance of controlling your blood glucose, not to undermine the importance of controlling your blood pressure, and of course, cholesterol as well. So these all need to go hand in hand.
Done. So, COVID-related diabetes question here, which is a
Yeah.
pre-registered question. I was
Yeah.
down with COVID on 28th April till 12th May. I am diabetic. I had steroids with which my sugar level has gone up. I increased my dose, but that still is not normal, though I decreased only afternoon dose. This is the exact typing that they have done. But I
Yeah.
understand that. I hope there is a physician who is treating and who hope you have not monitored your drugs on your own. So, with a word of
Yeah, rightly
caution.
mentioned, Ms. Jansi. I think it's very important that people take the help of a properly trained doctor on time, if at all they want to prevent the various complications of both COVID as well as diabetes, especially if they do have diabetes and if they contract COVID. The reasons are manifold. Let me try to list a few things here. When people develop COVID, even if they didn't have diabetes in the past, they can develop diabetes afresh because COVID can affect the pancreas and it can lead to diabetes afresh. One. Two, if a person were to have diabetes in the past, COVID can worsen the diabetes control, as in glucose control, because of sheer stress response and also because of the fact that some of these patients need corticosteroids. Corticosteroids used in even non-diabetic individuals, in people who have got COVID, can increase the blood glucose levels. And these high blood glucose levels are very difficult to control unless you use the right medications on time and monitor your blood glucose levels appropriately as asked by your doctor. And add to this, each time the corticosteroid doses get changed, either increased or decreased, the blood glucose levels can increase and decrease immediately. So you need to be very vigilant about these changes in blood glucose levels subject to your steroid doses. So please don't play around on your own in case you're doing that. I hope you did seek the help of a proper endocrinologist or a senior physician who takes care of your sugar so that they can guide you in the right direction. Remember, some people need insulin and that too in reasonably high doses if at all they were to be on corticosteroids and if they were to have COVID. So take appropriate help, take the medical advice that you have been given seriously and follow it appropriately in order to prevent the complications of both COVID. Because people who got poorly controlled blood glucose have a higher chance of getting admitted to hospital, higher chance of needing mechanical ventilation, and unfortunately, even death rates are higher in people who got poorly controlled blood glucose levels. Not to forget the dreaded mucormycosis, or otherwise called by as the black fungus these days, isn't it? So
Yes.
remember, all these complications are common in people who got poorly controlled diabetes. So do take care,
Okay.
please.
Right. Doctor, here's a registered question. I'm a diabetic and a smoker. Also, drink 2 to 3 pegs at night. Can this affect, or can this affect more?
Right. Let me actually give a piece of my mind because I'm very passionate about lifestyle, exercise, diet, smoking, sleep, and alcohol. So, first about smoking. How can smoking affect? I was previously mentioning that smokers have higher chance of developing diabetes. Smokers have higher chance of having poor glucose control because it increases insulin resistance. Insulin resistance, in simple words, means if a person were to be secreting the same amount of insulin as a normal, otherwise normal individual, if a person were to have increased insulin resistance, then the body would not be able to use this insulin properly. That means the blood glucose levels would go up. As simple as that. So, if you quit smoking, you can control your blood glucose levels better. It's not just that. There are a lot of things that you can protect yourself from. You can protect yourself from many cancers, right from top to toe. I won't even dare list them because right from oral cancer to esophageal cancer to liver cancer to you name it, almost every cancer is associated with smoking. So stop smoking and protect yourself from cancer. If you're a man, obviously erectile dysfunction or loss of your potency, this is pretty high in people who smoke. So if you want to save your virility, whatever you call it, stay away from smoking. Then if you want an earlier heart attack, then the best thing to do is to continue smoking. If you quit smoking right now, your chance of developing heart attack or a brain stroke, or for that matter, the chance of developing gangrene in your feet would significantly come down as soon as you stop smoking. So this is the right time to stop smoking,
Great.
and you would get your taste sensation back immediately as well. Trust me,
Oh,
all these years, if at all you were to be somebody who's been smoking, then you lost your taste. You haven't been enjoying food as well as it really tastes. So these are some of the aspects pertaining to smoking. Because pertaining to smoking, I can talk for 1 hour in total. So I won't talk for
right,
the rest
doctor.
of the time on smoking.
We
So let me
understand this
speak about
passion that you have towards. Please continue, doctor.
let me speak about alcohol. So, what can alcohol do? Alcohol can do enough damage as well. To begin with, see what happens when you take alcohol. You're taking a lot of calories without your knowledge. The so-called 2 pegs that you take means a lot of waste calories. That means they don't have any nutrients in them, in those 2 pegs, but unfortunately they add up a lot of calories. That means they make you put on weight. That means they can increase your insulin resistance. That means they can lead to poor glucose control. But there's a tricky aspect here. If at all you were to be using insulin or a group of medications called sulfonylureas, and if at all you were to drink without eating anything, you can have a low sugar. So
Somebody is
always
asking
make
another
sure,
question.
always make sure that you have some food before you actually consume any alcohol. If at all you were to be on insulin or you were to be on sulfonylureas. So this is what happens. But remember, the snacking that you do with the alcohol, all the greasy food that you eat, that's going to make your life miserable in terms of obesity, in terms of poor glucose control because of insulin resistance, increased risk of heart attacks as well. As if this is not enough, your alcohol would have a deleterious effect on your nerves, leading to what we call as neuropathy because of alcohol. Remember, diabetics anyway are predisposed to developing neuropathy because of diabetes. Add to this, you have the risk of developing peripheral neuropathy because of alcohol. And as if this is not enough, you're at increased risk of having blood pressure, increased risk of having bad cholesterol, especially triglycerides, and the list goes on. Not to forget the number of cases of liver failure that we come across because of alcohol becoming an addiction. So, in total, you're going to damage every part of your body, right from your liver, leading to fatty liver and cirrhosis and complications such as peripheral neuropathy, and of course, increased insulin resistance, hypertension, etc., etc. I think what starts as a fun sport, as I earlier mentioned, can lead to havoc. So the best peg is again the undrunk one.
Right. So, I'm anyway teetotaler. So, after this, I'm never going to even try. So, this is enough for me. And I hope people have
So,
got enough.
well, even if one person were to quit smoking or cut down, if not stop their alcohol, listening to this show, I think our job is accomplished, Miss Johnson.
Wonderful, wonderful, doctor. All right, there are quick questions before we wrap up because it's already 11:45. All right, there's one question about food. Can diabetes be treated, type 2 diabetes be treated without medicines only by controlling food? Like cereals, oats, brown rice, fruits, millets, which is ideal food for breakfast? Hiba had asked this. And there's another question about food. Is wheat bad for diabetes?
See, when we speak about food, I think we need to remember what is there in what we consume. When we speak about food, what does it contain? It contains macronutrients and micronutrients. What are macronutrients? Carbohydrates, proteins, fats. These are macronutrients. What are micronutrients? Vitamins, minerals. And of course, we haven't forgotten fiber as well. What is there in our food? So again, within carbohydrates, there are complex carbohydrates and simple carbohydrates. Complex carbohydrates means these do not increase your blood sugar levels instantaneously. Whereas simple carbohydrates, such as your white rice, such as your sugar, the table sugar, these or chocolate, these can all push up your blood glucose levels instantaneously. The other way to look at it is the glycemic index of a particular food. If a particular food can instantaneously increase your blood glucose levels like this, then it has high glycemic index. If a food has high fiber and it takes time to get broken down and it does not increase your blood glucose levels instantaneously and the blood glucose excursions are less, then you call it low glycemic index food. So this is about carbohydrates. Then you have proteins. Proteins are the building are necessary for building up your muscle, each and every cell of your body, amino acids, etc., etc. Okay, then you have fat. We know about fat, oils, okay, the greasy stuff that we eat, or the ghee that we have, and of course, not to forget the trans fats that are present in biscuits and all the processed foods. So, of these, what increase your blood glucose levels instantaneously is your carbohydrate. Okay, protein does not increase your blood glucose levels. Fat does not increase your blood glucose levels instantaneously, but the wrong type of fat and the wrong quantity of fat is not good for you in the long run. Why is that? Because it can increase your risk of cancers, it can increase the risk of your heart attacks, brain strokes, it can increase obesity risk, and also increase insulin resistance. So you need to eat the right kind of carbohydrates and right kind of fats. Remember, our foods have a proportion of fat, a proportion of protein, a proportion of your carbohydrate, and of course, fiber and micronutrients as well. So before you say, yeah, what food is good for me if I'm a diabetic? Should I abandon rice? Should I eat only millets? Should I eat only brown rice? So you need to know these basic principles that I told you earlier. So let us come to the example of brown rice. Brown rice in small quantities is good, but it has its own downsides. If it is not actually boiled properly, soaked properly for a few hours prior to cooking, it's not easily digested because of the content and layer surrounding the rice grain. But having said that, its glycemic index is less. That means it does not increase your blood glucose levels immediately, and the blood glucose excursions are also less. That's about this. Coming to millets, I mean, millets is not something that we have been used to eating over the last 1 or 2 decades. We cut down significantly, unfortunately, but it has come into fashion for good reason now. And I think millets should be part of our diet plan. If you can't eat it daily, at least make sure that you eat a few times in a week. I consume them regularly. I'm not a diabetic, but because of the what I say, the low glycemic index reasons, I think millets should be part of our diet plan. Okay, but having said that, it is unreasonable to expect somebody to eat only millets if at all that person is not used to eating millets all his life thus far and has been used to habituated to eating white rice. Coming to white rice is something which is very dangerous in terms of predisposing us to risk of diabetes, or if we already have diabetes. For both these two reasons, it's not good. But should you quit it altogether? Ideally, yes. But if you can't quit it altogether, at least cut down the portion of the white rice that you consume. And in lieu of that, try to eat a portion of millets or a portion of, we do have quinoa and oats and other alternatives around. Okay, so make sure that you have a proper diet plan devised according to your palate, according to your I would say local cultural habits, and make sure that the family is able to hold this as a long term thing. Okay, no point in starting something, following it for a week. Say there are many people who start a millet based diet, they eat that for a good 1 week, but after the seventh day it's gone. So what happened to your diet plan? It's gone. So this is not going to work out in the long run. So anything that you can actually continue in the long run is appropriate for you. Anything that is doable by the family as a whole is doable. What is not too hard on your pocket is also doable. We need to remember this as well. Okay, I may give you a very fancy diet plan. Okay, but if it is very hard on your pocket and if somebody can't actually follow it, there's no point in actually advocating that. Same with your fancy fat diets. Again, we can discuss that on a different day.
I think this itself is a huge topic. I think we should take care.
I know. We'll deal with it on a different day. I think this is something which will probably garner more attention than anything else. I'm very passionate about the so-called paleo diets, or rather the reasons as to why we should not follow that, the so-called keto diet, time restricted eating, and all these. It's a topic for another day altogether. But again,
Yes, doctor.
there are pros
So
and cons with
quickly,
each of these. We can discuss these at a different day.
quickly, I would want to sum up, ask a few questions that are being pending. Satish Kannan says, Sir, I'm 38-year-old taking insulin 25 by 75 mix. What's the difference between 30/70 versus 25/75? Same thing, somebody else is also asking. HP1, Shankar Pandyan says, HP1AC is about 10%, age is 30. Should I take my medicine? And somebody is taking medicine. All right, glycophage VG2, 50-year-old, taking for last 7 years. HB1AC is currently 8. What precautions do I need to take?
Right,
Three
rapid
different
fire.
questions.
Rapid fire. First, when you say 25/75 or 35/70, it means that the constitution of the insulin is such that there is only either 25% or 30% of short-acting insulin, and the rest is long-acting. That means the rest of the 75 or 70% is long-acting. Okay. Coming to the second question, if at all your HbA1c is somewhere around 9 or 10, and if you're not taking any medications, it's high time that you see your doctor and start some medication immediately. Third, if you're just taking, you mentioned the name of metformin in the form of a trade name. If you're taking metformin and your HbA1c is suboptimal at 8%, it's again time that you consult your doctor and you adjust your medication such that you can bring down your HbA1c to what it should be, which is usually around less than 7 in younger and middle-aged groups, usually, provided we don't have hypoglycemia. And not to forget the importance of the lifestyle changes that you are supposed to make. I underline that time and again.
Right. So one question Parvati Perechella is asking: metformin and long time use, side effects. This is what.
See, metformin should be the first line agent in general for all type 2 diabetic patients unless there is a contraindication. What is the absolute contraindication? If somebody were to have a risk of lactic acidosis because of serious heart failure or renal impairment, I mean, these are the sort of absolute contraindications we're speaking about. I can't speak for this particular patient, but this is in general about metformin. But in general, metformin can be used lifelong if at all there are no contraindications for metformin, and if at all the patient's clinical scenario warrants usage of metformin. Okay. One side effect that we come across with metformin is it can cause tummy upset, especially in the initial few days of taking it. So what we advise is start with the lowest possible dose, gradually titrate it up, and take it immediately after food. And we advise our patients that it can cause a bit of bloating. Some people can have loose stools, nausea, etc. But this settles usually with time, in a few days' time. And last but not the least, metformin can be associated with vitamin B12 deficiency, especially if you are a vegetarian. So this is about metformin in 2 minutes.
All right. Last question, and also I'll lead to the top tips with this question. Andarli Garu, your question can be taken up with Dr. Garu in person as well. A lot of people who have been asking questions. There are certain questions I couldn't take in time, and these are personal questions, so you can take them up with the doctor on his Apollo 247 consult. Right. Last question, and also leading to my top tips from you are: he's diabetic. Arun Kumar is diabetic, and what is life expectancy with type 2 diabetes? I'm just 30-year-old. Any effect on organs using medicines for long term? So to conclude this session, I would want you to give me tips on how to protect our organs long term while being a diabetic.
Firstly, avoid diabetes as much as possible by leading a healthy lifestyle. Eat well, eat right, sleep well, and exercise regularly. Make it a part of your lifestyle, a healthy lifestyle. But if you already have had diabetes, then it is time that you start positive lifestyle changes if you haven't been exercising regularly, eating well, etc. It is also very important to make sure that you follow the advice given by your doctor. Keep up the regular follow-ups as advised by your doctor. Do the tests that have been asked by your doctor. Get screened for complications such as your retinopathy, neuropathy, nephropathy, heart problems, etc. Make sure that you take your medications on time, in the quantity, and as advised by your doctor. And Also, make sure that you follow the lifestyle changes which have been advocated already. By doing this, you can lead a healthy lifestyle with good quality of life and making sure that you have a positive outcome for yourself, your family, and for the society as well. Thank you.
Wonderful, doctor. Thank you so much. As always, you are very, very motivating and really inspired by your commitment and passion towards spreading awareness. Thank you once again for being with us.
Thank you very much, Ms. Johnson.
Thank you. Well, that was a greatly informative session. So please take care of your health. And I'm going to give you 3 questions to answer. Here's the health quiz. The question number 1. Oh, by the way, I need to tell you where you have to answer, though you're a regular watcher. You have to answer. I'm going to ask you the question right now, and you have to type the answer in the chat box. And I'll have to announce I'll see who the winner is, and I'll announce the winner's name towards the end of the show. If you're announced as a winner, please write back to us with your contact details at marketing@apollo247.com. Gift vouchers will be shared with you. So get ready. Here's your chance to win prizes from Apollo 247. Question number 1 for this week is, which gland or organ produces insulin in human body? My question is, which gland or organ produces insulin in human body? So repeating my question once again, which gland or organ produces insulin in human body? That's my question number 1. So let me see who's answered. And question number 2 is, when is the World Diabetes Day observed? 2021 में अभी आ रहा है हाल ही में. So when is the World Diabetes Day observed? Question number 3, which option on Apollo 24/7 app allows you to book slots for vaccination for yourself and for others as well? I repeat my question number 3. Which option on Apollo 24/7 app allows you to book slots for vaccination for yourself and for others as well? So these are my 3 questions. Please go ahead if you don't know answer for any of these questions. Google भी कर लीजिए और आंसर टाइप कीजिए. मैं आपके आंसर्स के लिए वेट कर रही हूँ. I'm going to announce the winners in a short while. Before that, if you've got vaccinated from Apollo centers, any of the Apollo centers or facilities, then Apollo is going to reward you for keeping India safe. Vaccinate and find your reward. The rewards are like, you can claim 150 rupees discount on virtual consultation from Apollo 24/7, also 10% discount on medicines, and you can get free membership of Ghana and Lens card for 3 more months. So 3 months you can go ahead and get vaccinated from Apollo. By getting vaccinated at Apollo, you can just simply walk in. There are no more queues. You can just direct walk-ins are welcome. And if you want to book your slot, find Apollo centers on www.cowin.gov.in. Book the slots through Apollo 247 app and walk in right. So this is about rewards for vaccination. And let me see if we have some answers coming in. Yes, COVID-19 vaccine nahi. 14th November, 19th November, pancreas. Oh, a lot of them have given their answers. And the winners of today's quiz are Akif Ahmed, Sean David, and Parvati Perechella. Congratulations. Please write back to us at marketing@apollo247.com. Thank you all for joining us today. And here are some gift coupons that you can use on Apollo 247 app. Get $199 off on online consultation with Apollo doctors and 15% off on medicine orders. The code to use is HH247. Thank you so much, all of you, for joining. Please take care of your diabetes and your health. Prevent organ damage due to diabetes. Thank you once again.